Hello and welcome. This is just a short video aimed at discussing the role of the nurse in meeting the health and well-being needs of the community of males aged over 45 years with relation to colorectal cancer. I will also be discussing how these roles can be put into place with recommendations for strategies aimed at reducing the health effects of this issue, with consideration of the various challenges and opportunities that may present as well. Among the many roles of nurses, a few of the most impactful within the context of this scenario relates to raising awareness, conducting risk assessments, providing education to caregivers, and collaborating with the multidisciplinary teams to provide holistic, patient-centered care. Firstly, nurses play a pivotal role in raising awareness about colorectal cancer, especially among males over 45 who are at higher risk. Nurses can lead community outreach through initiatives that enable them to leverage their clinical expertise to educate men about the importance of screening and preventative measures. Through information sessions and social media platforms, to name a few, nurses can spread vital information regarding symptoms, risk factors, and screening options, as well as providing emotional support and reassurance as many men might fear diagnosis. The nurse's ability to effectively communicate will allow them to connect with members of the community, breaking down barriers to understanding and encouraging proactive health behaviours. Nurses are also well positioned to conduct thorough assessments for colorectal cancer. This includes retrieving detailed medical and family histories and assessing lifestyle factors, such as diet and physical activity levels. Through regular health screenings and checkups, nurses can identify individuals at higher risk and encourage them to pursue screenings. Nurses are able to fulfill their role through evaluations that are comprehensive and tailored to individual patient needs. Proactive identification is crucial in identifying and/or preventing advanced disease and facilitating early intervention. As we know, education extends beyond the patient to caregivers, as these individuals play a crucial role in supporting men within this community. Nurses can develop and use educational materials and programs that are tailored to caregivers and emphasizes their importance in the screening process and in providing ongoing support. By empowering caregivers with education and positive coping strategies, nurses can also create a supportive environment that encourages men to prioritize their health and engage in preventative measures. Lastly, nurses play a crucial role in providing men with effective management of colorectal cancer through their collaboration with the multidisciplinary teams. Nurses serve as vital links between various healthcare professionals such as oncologists, dietitians, and social workers. They facilitate communication and coordination of care, working to the best of their ability to address all aspects of the patient's health and contribute to the valuable insights into the patient's life, their needs, and preferences. Their role in advocacy and fostering a comprehensive care plan plays a vital role in not only optimizing health outcomes, but influencing and enhancing care policies and practices moving forward. In saying this, there are several ways in which these roles can be enhanced. In addition to enhancing training and resources, utilizing social media and implementing telehealth services can further assist nurses to bridge gaps in care, particularly for those who have issues with transportation. This would support nurses' roles in providing virtual education sessions, conducting risk assessments, and follow-ups to ensure continuous support and monitoring. Through community engagement initiatives, nurses can foster trust and encourage men to participate in screenings. This could be done by forming relationships with local organizations such as churches and community centers. Other strategies that could be implemented is the establishment of a formal support network for patients and caregivers. By facilitating these, nurses can enhance emotional and social support, as well as provide a platform to share experiences, resources, coping strategies, and ultimately reinforce the relational aspect of care. Finally, nurses can also advocate for policies that increase access to colorectal cancer screenings and treatments. By taking part in health policy discussions and lobbying for funding for preventative services, nurses can help encourage an environment conducive to better health outcomes, and potentially also address social determinants of health that impact access for men in this community. Implementing these strategies does unfortunately involve unique challenges such as limited funding and resistance to screening due to factors such as cultural beliefs. These challenges do, however, present opportunities for innovative solutions. For example, Culturally tailored educational materials can address specific concerns within the community, and partnerships with local organisations can also facilitate outreach efforts. Engaging communities through local leaders can also enhance trust and participation in health initiatives. By leveraging existing relationships in the community, nurses can create an inclusive peer support network that encourages men to implement proactive health measures. To conclude, an essential role in addressing the health and well-being needs of males over 45 in relation to colorectal cancer. They can significantly impact the community health by focusing on awareness, risk assessment, caregiver education, and collaboration. Enhancing their role through the previously mentioned strategies can lead to improved health outcomes and possibly a reduction in colorectal cancer incidence and mortality rates within this high-risk population.